All right, so I want to go through one more example of an injury, specifically anterior cruciate ligament tears. There's been some recent articles that have hit the lay press and were just recently published in the British Journal of Sports Medicine, and I thought it was a good time to specifically look at this issue. All right, so first I want to remind you that very simply, injury is when the loading on the tissue exceeds the tolerance. And tolerance is just the strength of the tissue. So let's look at the loading on the anterior cruciate ligament. It can come from contact. And so here's the image of the football helmet going into the knee is a good way to rupture your ACL. And then you hear a lot about non-contact or landing forces. And that is when your ankle goes into inversion, you have dynamic valgus, you have a rotation of the femur relative to the tibia, another way to rupture your ACL. So there, and we'll talk about this a little later about how we can modify that loading. And then we have the tolerance or the strength of the anterior cruciate ligament. And there's a lot of systemic factors that can affect ligament strength. One is what they call big quad, small hamstrings, or the quadricep to hamstring ratio. And it sounds really simple. Oh, just measure the strength of your quads versus the hamstrings and figure out if the ratio is good, and then just work on your athlete or your participant and get their ratio good. Just remember the joint angle at which you're measuring strength can affect this ratio and the speed at which you are measuring the strength. So it's not as simple as it sounds. You can also look at landing patterns. There's a lot of work being done on how females versus male land. Sex can affect the tolerance of the ACL. Also, just through anatomical differences in the notch that the ACL goes through on the femur. Age can affect the tolerance. Our tissues tend to weaken as we age. And then there's this concept of laxity of the ACL, and that has to do with estrogen, and then that gets into the menstrual cycle of your female athletes. All right, so there's some recent articles, one by Chung that looked at uh, osteoarthritis and ACL reconstruction. Philbay et al. Was looking at ACL rupture um, and outcomes following a non-surgical management called the cross bracing protocol. And then there's also an article in a magazine that I have linked on this slide as well that you can click on for an easy read of both of these articles. All right, so back to injury is load greater than tolerance. And so just to kind of color coordinate things, injury is red because injury is bad. Loading is in blue, and that's the loading that is applied to the tissue. And then the tolerance or strength of the tissue is green. And so after an ACL injury, as a rehab specialist, for those of you going into physical therapy, you are trying to regain that tolerance or that tissue strength. So then the question is, do you do it surgically or is there a conservative treatment? Um, so looking at this ACL injury just a bit more, um, there's a limited healing capacity. That was thought that's why you needed to do ACL reconstruction. That seems to be a myth. The ACL has a rich vascular supply. It just has a very slow healing rate. And again, this is all from those two articles, so I invite you to go look at them, and I will put them in the description on this video. If there's tissue bridging, meaning if the ACL ruptured, but it's still kind of close to each other and somewhat touching, that's a good thing for healing. And they found that the distance between the ACL origin and insertion is shortest at 90 to 135 degrees of knee flexion. So then people came up with this cross bracing protocol, which the paper is from Australia. They keep the participants immobilized for 4 weeks at 90 degrees because that's the best option to get those ends of the ACL touching each other. And then they increase the range of motion each week using the brace to kind of start the mobility process. So far, they've had good results. This paper had 80 subjects. If after 3 months, the healing on the MRI was a grade 1, you had the best results. So you could almost use this as a screening too, and to figure out who may have to have reconstruction. Only 10% of the participants did not have any signs of healing, meaning 90% did. 14% were re-injured, and 92% with grade 1 returned to sport. So this is just an image showing you the anterior cruciate ligament tear, and that if you get that knee joint into 90 degrees, you can get those ends of the ligament touching each other to start this healing process. And so here's some images of the cross bracing protocol. So they brace you at 90 degrees and you have to stay for 4 weeks in that position. And then every week they kind of extend your knee joint and give you a little bit more mobility while they're also rehabbing you. So this is a non-surgical treatment. So let's switch gears and look towards anterior cruciate ligament reconstruction, or ACLR. 55% of non-professional athletes return to sport after reconstruction. So you can determine if you think that's good or bad. Osteoarthritis. 50% of patients who have surgery still develop it within 12 to 14 years. There was a myth that reconstruction prevented OA, and that is a myth. However, reconstruction could help with if you had some meniscal or cartilage issues. There was a meta-analysis in 2018 that looked at radiographic views of knee OA. 5 years post reconstruction, 11.3% had OA. 10 years, it went up to 20.6%. And after 20 years post surgery, about half of the participants who had reconstruction had radiographic evidence of osteoarthritis. So I think as we see more and more people getting reconstruction, you could have an interesting rehab population waiting for you in 20 years down the line. All right. And why might this happen, that you could get an additional injury of osteoarthritis? And it goes back to the loading, right? They call it PTOA, or post-traumatic osteoarthritis. And it's because even after reconstruction, your loading on the knee has changed. And they highlight a few changes. Kinematic changes, so there's an increase in AP translation. There's an increase in internal rotation, and 85% of ACL reconstructed knees have abnormal tibial rotation during the stance phase. It's also interesting that the proprioception that was in your ligament that kind of told your body where your joint position was in space, and then recruited your quadriceps and hamstrings to kind of adjust, is impaired. So again, you're going to have an altered loading of the muscles on that knee joint. All right, so prevention would take us to the other side of this equation and into the tolerance. So if we said, all right, maybe reconstruction is not great, can we figure out how to decrease the risk of ACL injury in general? The loading, like during sport, sometimes we can't control because it's during competition, but maybe we can figure out how to increase the tissue strength. Again, we can go to the muscle strength of the quadricep hamstring ratio. You can work on landing skills. One study suggested exercising all year. Rest is important, but maybe active rest, but you don't want those periods where it's total rest and then you come back into season and ramp up your training levels, which usually in all things, not even just ACL, can result in increased injury. And then FIFA has had some success with their 11 plus program. They showed significantly reduced injury rates of around 45% and decreased time lost to injury by 30% in competitive soccer players. And what is the FIFA 11 Plus? It's a whole program that people do before competition. It starts with running and then strength and plyometrics and balance exercises. And you can see it goes through like level 1, level 2, and level 3 of different exercises. So this might be something that you don't need to just use on your soccer athletes, but in general for any athlete that might be at risk of rupturing an ACL. So again, injuries load greater than tolerance, and you can look at this problem from both the loading side and the tolerance side, both pre and post ACL tear.